Alright, so today we are going to be going over bed bath. First, we want to make sure we have all of our supplies. Make sure you have your gloves. You're going to have a towel, maybe two if needed. You're also going to have a bunch of washcloths as well as your basins. Now, some of your clients might prefer a hospital or hospice grade soap. That's a no rinse. So you would just simply take this and add it to your basin, make a nice soapy water mix, and be able to give the person a once over and they're clean. Or maybe your client's still using their favorite, Dove or Axe body wash. We can add it to their other basin, make a soapy water mix, and then have one that's just water to rinse off afterwards. So there's no soap scum residue.
It's always good to communicate with your client. Make sure you're using the right pressure, the right temperature water, everything feels okay, and then you'll be good to get started. Another key tip, you always want to make sure you're working in your green zone. You want your bed nice and close to your hip level. This way we're not bending over and breaking our back. So I'm just going to get her up a little bit. It's also important too that we try and maintain our clients' privacy as much as possible. We don't want them to feel like they're laying out on display while we're getting them cleaned up. So a lot of our clients are going to have a designated blanket or a towel or something to keep them covered. Definitely be respectful of this if there's someone who wants to stay covered. You are always going to go cleanest to dirtiest, top to bottom, front to back, always. Starting with the face, making your way down, and the hair is going to be like the cherry on top. If we do the hair first, they're going to be sitting here with a cold, wet head, which is going to make the rest of them cold. So face down. If I am using the double basin method, I will always make sure to have my washcloths soaking in the warm water and then move them to soap as needed. Especially with starting with our face, I'm going to clean off the eyes first, and I don't want to risk getting any soap into the eyes. Quick little trick. I always like to take my washcloth, fold it in half, take it and fold it in half again. This way you have 4 clean corners to wipe along the client. Once you've used all corners, you're done with this washcloth and can switch out for a new one. So starting with my first clean corner, I'm going to go ahead and get all of those eye boogies out of the way. And then from here I can introduce soap to my rag as well. And then go along with cleaning the rest of the client's face. Making sure to get behind the ears and coming down the jawline. Getting that neck cleaned off. And I always try to dry off as I go. This is going to help with keeping the client stay nice and warm too. They're not going to be getting cold. We also don't want moisture to be hanging out on the skin for too long, especially in any little nooks or creases. The moisture can hang out here and cause a skin infection, and that's no good. So once I've done the face and made my way down my neck, I'm going to continue making my way down towards the chest. If we are working with a client who has breasts, it is super, super important to pick up the breast and get underneath and get all, again, in those nooks and crannies, in the skin folds. Super, super key. It's, again, more important that we're drying off than we are washing, especially in those nooks and crannies, as that moisture, again, will retain and start a skin infection, and that's the last thing we want. Okay. And I am going to continue going down, getting the rest of the stomach. Now that I've essentially done the torso, I'm going to extend out and do the arms. A nice little trick I like to do here is I'll take my towel and have it follow me and kind of go underneath where I'm working. This way, in case my washcloth is dripping, making a mess, I got an extra barrier, or once I'm done washing them off, my towel's prepped and ready and I can get her dried off real easy. You always want to do the base of the arm up to the fingers and getting in between the fingers, getting those nails. Okay, and then you're going to make your way up and into the creases. I'll normally wrap the rag around my hand, kind of making a nice little mitt. So then I can help and kind of know my hand's fully covered and get all the way around, all up and in that armpit. The arms and the legs are a great spot too. You know, you can get front, side, back, all the way around. You can help your client pick their arm up and get that underside, or if that's too hard, you can kind of just trace along underneath their arm as well. And again, your towel's here and ready for you, prepped, ready to go. We can just bundle up that arm, get it all nice and dried off. I would, of course, do that other arm as well. Now I've done the top half of the body, so I'm going to continue my way down. And I am going to, again, try and maintain my client's dignity, keeping her as covered as possible. I'm just going to pull up this blanket just out of our way a little bit so we're not getting any water or anything on it. And I'm also going to take my towel and go underneath her legs just like I did with her arm, supporting at the joints. Okay. If my client's feeling extra cold, I can even take this extra and kind of bundle up the leg I'm not working on. That way, again, I'm only exposing one area at a time, trying to keep her nice and warm, maintaining some of that dignity as well. Again, with your arms and your legs, you are going to do the base of the leg, getting as much as you can. Front, side, back, all the way around. Bending the leg is a great help. You can really get underneath and get that upper thigh really well. Once you've gotten the base of the legs, again, you're going to make your way down towards the feet. Make sure to get in between all of those toes. Okay, if your client's ticklish, really talk to them and let them know what you're doing, and make sure to use good pressure. If you're using light pressure, it's definitely going to tickle more. And we're going to say I did that leg as well. And we're going to get her all nice and dried up so we can get up into the pericare area. And now normally, oops, snagged your toe. I'll just take this towel and kind of move it up on top, helping keep her feet and legs nice and warm since that's where I just worked. And I would move my blanket up out of the way so I can work on the pericare area. I always like to do the 4-corner method when I'm working in the pericare area. This way I know I'm always using a clean corner of my cloth. I'm going to help hold the vagina open just a little bit, grabbing that first corner, lining it up at the top, moving one fluid motion straight back as far back as I can, no scrubbing. Okay, move that corner out of my way. Nice clean cloth that hasn't touched my corner, my client. Now I'm going to go down that side, moving that corner out of my way, and once down the middle. And then I'll typically use that last corner and wipe along top where my hand was holding. I've used all 4 corners. I'm done here. And I can kind of move my towel up as well, really making sure I'm drying off all those nooks and crannies. Okay. Go ahead and give you your blanket back, and we can get you on the side, your side, and clean up your back side. There's a good chance you will need to freshen up your water as you go, making sure it's staying nice and warm throughout this experience for your client. We want to make this be, a nice spa day for our people. It's not something we're just trying to hurry up and get done. We want it to be enjoyable for everyone. I'm going to move your arm up and out of your way so you don't squish it. And I am going to help my client bend their arm and bend their leg. And my client is going to reach on over for her bar, and I'm going to give her a boost over. And now I am going to grab my washcloth, finish cleaning up that back side. When your clients are on their side, this is also a good chance to get that back of the arm, back of the neck, and those upper thighs if you had a hard time reaching them from the front. All right, now we're gonna clean the bottom, and I am starting with a clean rag, and I am going to go as far up as I can reach, kind of coming out at an angle, moving that corner of the cloth out of my way, going to the other side, one time right up the middle, and then that last corner I will wipe along the back. Normally about here, I will take the time to dry off the bottom real well. And then I am also going to lay the brief down so no accidents happen. And I get it kind of just prepped into place. I don't fully close it, but again, just in case any accidents start to happen. Then from here, I am going to continue on with getting those hard to reach areas like the back, the upper neck. If I had a hard time getting the shoulders, I can get the shoulders now. Again, really making sure to dry off as you go. If you had a hard time getting the upper thighs, making sure you can get those upper thighs now as well. And again, making sure you dry off as you go. We don't want moisture to stay and hang out on the skin. And we can help our clients to lay down. And we can finish closing up that brief. Always talk and communicate with your clients. Ask them as you go along, how's the pressure? How's the water temperature? Do you need to scrub anything anymore? Again, communication goes a really long way. All right.